everyone, Gavin Ravens, personal trainer and stretch therapist here in Miami Beach, Florida. And here in this video, we're going to show you how to do AIS Stretch Therapy and apply it to any kind of muscular-related symptoms you have going on in your lower body, namely from the belt down. So it's going to cover your hips, your knees, your ankle, calves, quads, hamstrings, abductors, adductors, and your hip rotators, internal and external. So in this video, we'll cover how to take care of muscular-related sciatica, unexplained knee pain, unexplained back pain, your plantar fasciitis, your patellar fasciitis. All you need for this video is a 7-foot nautical rope. If you've seen any of our other videos, you'll know exactly what I'm talking about, or a rolled up towel. Let's go ahead and get started. So what is AIS? AIS stands for Active Isolated Stretching. And it's a method of stretching that is used to very gently get a good stretch out of the muscle without locking up muscle tissue and tearing it and causing any scar tissue. So how we do it is we go into it real easy into the stretch very slowly and very, very gently get to the point of where there's most resistance and you can't go anymore. And you hold it in that stretch for just 1.5 to 2 seconds, and then you come out of the stretch just as easy and gently and slowly as you went into it. So in that way, it's going to treat your muscle much more gently. We're not fighting yourself, you're not fighting your muscle tissue. We're going to be going real easy, and in that way, we're going to get a better stretch than you've ever felt. Okay, so let's go ahead and get started with the hamstrings and calf, and let's do it. So go ahead and take your shoes off, and you can take your nautical rope, or if you have a hand towel, just fold it up, double it up twice, and then you're going to put it around the same area around the foot that we're going to use for the rope. If you have a nautical rope, double it up evenly and parallel. And you're going to wrap it around the bottom of your foot, just underneath the ball of your foot. And you can hold it in one hand or two hands. I prefer two hands. I get a better stretch and put it a little bit deeper. I'm also I have a stronger upper body. I need more to stretch my stronger lower body. So go ahead and position yourself on your back. If you have back pain, it is very wise to keep your opposite leg bent. If not, feel free to keep it out straight. So go ahead and position that just like that. Get a firm hard grip. Again, you can use one hand if you like. I prefer two hands. And we're going to take a deep breath, and remember that rhythm that I taught you in the beginning. It's going to be exhale, nice and slow, deeply into the stretch. And you're also going to be assisting with the opposing muscle group. So we're stretching at the hamstring. You're going to be using the quadriceps to assist the stretch. Okay? So let's go ahead and do that again. Deep breath. And since this is a complex stretch, we're stretching out the calf and the hamstrings at the same time. So you're also going to pull up your toes like that to give you an even deeper stretch. Okay? So we're going to go 5 to 7, straight forward. You're going to relax in every movement. Okay? So deep breath in. Pulling the toes up, engaging the quads, and relax it down. And again. Deep as you can. 1, 2, and release it. Feeling really good already. Oh yeah. 1 and 2. Releasing down. So you see I'm supporting my knee here so I can completely relax my leg. And in doing so, you allow the blood flow to get there, you pump out the cellular debris and lactic acid, and you allow your muscle to fully recover between repetitions, so you can get a deeper stretch every time. Very good. Now I didn't say it's painless, but it is slightly less painful than just holding the stretch forever, and it's very, very much more effective. Perfect. There we go. Release, and again. Pulling the toes up, exhaling into it. 1, 2, releasing, relaxing. 1, 2, and Let's go for one more. 1 and 2. Nice job. Good. So we're going to go ahead and switch feet, switch legs. Make sure your rope is parallel if you're using the rope. And on your back again. So, to review, deep breath in. Exhale. Contracting the quads and the tibialis anterior right here, both of these muscles. As you slightly pull and go deep into the stretch. 1, 2, and relax. Very good. One, 2. Very good. Relaxing completely. And going back into it. Here's 3. 1, 2. Very good. Perfect. So you notice on this leg, I'm able to get my knee a little more straight. When I'm able to do that, it's then my arm's job to start pulling it this way and give me a stronger hamstring stretch. 1, 2. Very good. A few more to go. 1, 2. It also may not be a bad idea if you're very locked up and you're very tight to every time you come up and do your stretch, 1, 2, to come down all the way and relax your leg completely. It will serve to better allow the stretch if your muscles just aren't giving in. Okay, and last one here. Engaging the tibialis anterior, and the quads, pulling up, 1 and 2. Excellent. Oops. All right. Good. So for the purpose of this video, we're just going to do 1 set on each side, about 5 to 7 on each targeted muscle. But what I'd like to see you do at home is 2 to 3 sets of each exercise, because the first set is just going to serve almost as a warm-up and a light stretch. The second one is going to really start breaking up that tissue and allowing it to open up. And the third one the third set is where you're really going to start to see some stretching gains. Okay? So remember to not force anything. It's all about allowance and assisting your body in stretching out the opposite muscle group. In this case, the quads are helping assist the hamstrings, and the tibialis anterior is helping stretch out the calf. Okay? So great job. Let's go ahead and move on to the next one. Excellent. So here we are with our second stretch. We're going to go ahead and stretch out the opposing muscle group, being the quads. Okay? So we're going to assume a lunge position, just like that. Think right angle with the front leg, right angle with the back leg. And then once you have a good firm foundation here, you're going to move your front ankle forward 12 inches. So if my foot's there, 12 inches will be about there. Okay? Perfect. So your knees are more or less going to be in line with where your hip socket is. Your arms, you can have at your sides, or you can bring it up top behind your head, or wherever is most comfortable. I prefer behind my head here. Okay? So deep breath in, exhale, and you're going to slightly contract your abdominals to keep your pelvic alignment here, and going deep in there, and return back to center. So what we're targeting here is the quads on your right leg. Left leg's forward, quads on the back leg are going to be getting stretched. And in order to assist this stretch, you can use your back glutes and you can use your back hamstrings to help pull back as the front leg is pulling forward. As that's going to give you an even deeper stretch. Okay, so let's go ahead and bang out 5 to 7 here. On your, again, this is just going to be one set on each leg together. Later on, I'd like you to just pause, stop the video, go ahead and finish 2 to 3 sets on your own. Okay, here we go. And contract the abdominals, contract the glutes. Nice and deep. Make sure your hips aren't shifting. You want your hips squared up, facing forward. Good. 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 Go at 4. Nice and deep. 1, 2, and 5. Remember to get that count. Good. So you don't want your knee to pass your ankle at any time. If you feel that you are, go ahead and move your ankle out even more. Okay. Last one here. Very good. Very nice. I feel a good stretch, especially up in my hip flexors. So, other side, right angle, right angle. Move that ankle out 12 inches ahead. Square your hips up. Bring your hands up behind your head. Take a nice deep breath. And contract the abdominals. Exhale. Good, right into it. So I seem to be pretty flexible on these. You may not get so far. It's just a matter of, on your own personal level, how far can you get? Hold that stretch 1 or 2 seconds and then come on out of it nice and easy. One, 2, good. And 3. Still going. 1, 2. Perfect. It's a bit of a workout, this kind of stretching too. So you're using a lot of other muscles to help stretch out the opposing muscle. Here we go. Good. 4. You see I'm pushing my weight to the front leg. Push me back out of the stretch once we're done. Perfect. Here we go. Deep, deep, deep. Oh yeah. 1, 2, 5. And 2 more. And last one here. One, 2. Perfect. Excellent job. So that concludes the quads, the hamstrings. We're going to go ahead and move on to the abductors and also the groin. All right, so here we are with our groin stretch. This one you will absolutely need to have a nautical rope. If you do not have one, go out and get one and use it for this stretch. If not, go ahead and skip this one. We will have videos up in the future using other modalities to stretch the groin, and some even using, you're not needing any assisted materials at all. So before we get started, a couple of notations here. Those of you who have very tight hips, you may find it difficult to do this one. You'll get jammed up in your muscle in your hip, so you may feel this more up in the outside of your hip than in the groin. If you do, go ahead and move on to the next stretch, which is going to be for the hip, and then come back to this one. The other notation would be your opposing leg. If this does bother your back, again, make sure you keep this opposite leg bent throughout the entire stretch. If not, keep this leg straight out. It will provide a little more leverage down than it will up, okay? So here we go. So grab your rope, wrap it around your foot. Now watch carefully with this. If you wrap it the wrong way, it's not going to work. We're going to wrap it, if we were to wrap it around the outside here, it would provide external rotation of the hip. And on this one, we don't exactly want that. We want it to be pretty level. So we're going to wrap it around the inside, parallel. Make sure it's around the center of your foot there. And what that's going to do is it's going to keep it level with a slight internal rotation. And I'll show you why that's important. Because as we come back down and we perform the stretch, you see how it has stretched the groin right there, rather than if we had external rotation, it'd be way out there and we would be stretching the hamstrings more than anything. Okay? So let's wrap that up the correct way. And excellent. So we're going to start here on the floor. This one, I highly encourage you, take a break between every repetition. Okay? Lift your leg up. Take a deep breath, and as you lift it up, I can relax my leg here, more or less keep the quads tight, but relax my leg, and I just hold it up with my arm. But I want to have good leg control as well as good arm support on this one, okay? So, legs up, deep breath in, exhale, and pulling with the rope up and out, assisting in the stretch, assisting in the rotation, and isolating on the groin. One and two, go ahead and bring it back in, relax it down completely. And remember that you're assisting with the hip up here, the opposing muscle. The groin is going to be the abductors. Good. And once you get that stretch, it may take a little while. 1 and 2. I'm going to choke up a bit so I get a little more leverage. And I'm going to actually bend my other leg because sometimes it'll give me a little back pain. I've had a history of sciatica, lower back pain, all sorts of catastrophe in my lower body before I started stretching like this. So deep breath in. And we're going to keep going, keep assisting. 1 and 2. Bring it back. And again, you don't need to feel a huge stretch on this one. Just get it to the end. You know, the groin is a rather sensitive area. 1 and 2. You don't want to pull too hard on it, or you may feel a slight discomfort in your groin. Pulling your groin is one of the most uncomfortable sensations I think you could ever experience. And I had the misfortune of experiencing that when I was younger, and I pulled my groin during cross practice one time. And it took a few weeks to recover, and in that time period it was just so uncomfortable. So lesson learned, be gentle with your groin when you stretch it or you're working it out. Okay, leg up. Bringing it on out. Now I'm bringing it up and out and over and down for the purpose of this video. I'm actually combining a few different versions of this stretch to make it easy for you to go. 1 and 2. Because most people they can't bring it straight out to the side, and that's actually the real stretch there. I know I tend to get jammed up in my hip there, so go ahead and bring it up. Bypass that hip tightness and bring it out to where your groin will get a really good stretch. So here's it again. 1 and 2. And last one here. upper body strength. 1 and 2. Good. Perfect. Oh man, so I'm feeling my groin starting to twinge there. Got a nice stretch on it. You may find you can only get it back here. That's totally fine. I stretch all the time so I can get pretty far, but work on that until you can get it all the way down to the floor. And when you get to the floor, pulling it up a little higher. Okay? So this is, of course, you know, the AIS self-stretching portion. I, of course, do this for a profession. I do it every day, stretching out other people. The active isolated stretching in a way is called assisted isolated stretching when a practitioner is using it on a patient or a client, which I do practice every day. So let's go ahead and hit the other side here. So remember, which way do we want it? Do we want external rotation or do we want internal rotation, right? If we did external, we're going to be stretching the groin a little bit. I mean, the hamstrings, we don't want that, right? So we're going to do, oops, I had the right way. Internal rotation. So keeping my other leg bent, deep breath in, and oh, you can feel it on this side. 1 and 2, bringing it back and relaxing. Oh yeah, my groin's wiggling, it's twinging from all the stretching. And remember to assist with the opposing muscle group, in this case the opposing hip. 1 and 2. You may also find, as you hear me counting, sometimes I count 1 and 2. I think I'm at the end, and it starts to give a little more, so I just restart my count again until we get to that 1, 2. Here we go. And here we go. 1 and 2. I've straightened my opposite leg out because I was actually using my hip up here and getting a little jammed up, so brought that down. Here we go, resetting my twist here, choking up a bit for better leverage, supporting my neck with my hand, and here we go. And still going, still going. There we go. 1 and 2, good. Whew. Not easy to stretch the groin, I'll tell you that. There we go. Keeping that leg straight too. You want to use your quads to keep your leg fairly straight. And there we go. Still going. Still a little bit. And there it is. 1 and 2. A little break after that. And let's go for a couple more. Up. And over, straighten your leg. And get in there. 1, oops, a little bit. 1 and 2. Nice. And final stretch here. And 1 and still go. 1 and 2. Perfect. Good. So I know that may not feel like a lot right now, but when you get up and walk around, you're definitely going to feel your legs maybe a little more wobbly, loose, and you're going to be tightened back up a little bit to kind of try to compensate for being so loose all of a sudden. All right, so we covered the hamstrings, the quads, the groin. We're going to go ahead and move on to the hips now. My favorite thing to stretch with my sciatica that I got rid of. It's really something that I keep up consistently with keeping my hips open with internal and external rotation. So let's go ahead and move on to that, and excellent job so far. So this one, you're not going to need any kind of rope or towel or anything. You're just going to need your hands. So we're going to stretch out your gluteus and your gluteus maximus and also your piriformis at the same time. Now you may not be able to get to your piriformis if you are constricted by other muscle groups here. So just follow along, do the best you can. And I'm going to go directly to the end or goal of the stretch. Just follow along as best as you can. All right. So this time we'll start off with the left leg. bring it up. And again, of course, feel free to use the other leg if your back is getting any pain. I know I like to keep it like that. So you're going to grab the outside of the foot here, and then you're going to support with your other hand right on the outside of your knee. So grab on the bottom and outside of your foot and outside of your knee with the other hand. Now you can sit up on this one and give yourself a little assist. I like to keep my head down and let my arms do the work. Okay? So this is going to be similar to the yoga position, pigeon, but you're actually using your own body weight to control the stretch rather than lay down on your leg and let gravity do the work. Okay? So we're going to grab here, and you're going to take a deep breath, and you're going to bring your knee toward your lower ribs down here. And as you bring that over, you got to use your back and your core to keep your hips down, because you don't want to just roll over like that. You got to keep your trunk sturdy to provide support so you can bring that over. Okay, so bring it over toward there. You're going to start feeling your gluteus maximus, maybe even like your proximal hamstrings. And then once you get over as far as you can go, then with your right hand, you're going to pull. You need a little rotation there. Perfect. And 1, 2, release, and come back to resting position. Bring it on back up. I'm going to let my right leg just kind of relax. You can actually adduct it a bit if you want to get additional leverage here. So, bringing it up. Deep breath in. Exhale. And rotating. Pulling it over. 1, 2. Very good. I did a leg workout yesterday, so my legs are pretty, especially my abduction over here is pretty tight. Over, deep as you can, stretching out the glutes, and then rotating, firing that piriformis. Getting as much rotation out of it as you can. 1 and 2, slowly release all the way out of it. And relax completely. And here we go again. So when I'm working with someone and I'm assisting them, I'm actually standing over here, and I'm actually either pushing here, or I'm standing over here and I'm grabbing here and I'm assisting in the rotation. So it makes it that much easier for the client or patient to not have to do as much work, but also they have their hands on there pushing as well, so you get a deeper stretch. Sometimes it can be more painful, but it will be more effective. Here we go, as far over the rotation, 1 and 2. Remember not to push too hard. It's all about building the results gradually, not trying to get there too fast. Up and over. Yeah. Oh, that's really good. Remember, pushing toward the lower rib cage. And getting there. Rotation's going really much better. 1 and 2. Perfect. So we're kind of aiming toward the lower rib cage here. There's 2 versions of it. One is the last rib, and the other is actually your armpit or the axilla. The theory here is that the lower, when you aim toward the lower end of your rib cage, that it actually stretches out one end of your piriformis, and the other, when you go up to the shoulder, stretches out the other end. So each will, like we stretch out the proximal hamstrings before, there's another stretch to stretch out the distal. The distal hamstrings. There's another stretch to stretch out the proximal isolated. So keep in mind, this one is just a general stretching AIS introduction. Just go ahead and just aim for your lower ribs and do the best you can. Okay. So here we go again. Deep breath in. Exhale. Pulling it over first. And then once you get it all the way over, then add the rotation. Good. And I'm losing them. There we go, perfect. 1 and 1, 2, perfect. I think I'm going to go for one more and then switch sides. Let's get pretty intense. Good. And rotating. 1 and 2, very good. Go ahead and release rinse that completely. When performing more than one set, I encourage you to, especially when you're doing something like when you're doing both your legs or both your arms, go ahead and switch legs. So do one set with your left leg, go ahead and do one set on your right, go back to the left, do a whole set on your left, and consider it like a workout. Contribute the amount of time that you can to it. But you expect to see the accumulating results as you would see with workout. You'll see accumulating results with the stretching. Okay, so let's go ahead and switch to the right leg here. Back on our backs. Right hand on the right knee. Left hand wrapped around the outside of the foot. And if you like, add up to your opposite leg if you can, without compensating your hip position too much. And deep breath in. Exhale, bringing it over, aim for that last rib or the lower rib area, getting a good glute stretch, and then adding some rotation here. Good. I'm not moving too much, so I gotta warm that up. 1, and it's still going. There we go. 1, 2. Good. I think it's gonna take a couple to warm that up for me. It's gonna bring this leg up, see if it makes a difference. And deep breath in. Exhale. Bringing it on over. There we go. And rotation. Now I'm feeling it. 1. 1. Now still moving. 1 and 2. Perfect. Good. My legs are feeling like jello. Starting to kind of shake a little bit all over the place. It's a good thing. Good. Right hand, right knee. Deep breath in. And bring it on over. Rotation. Oh yeah. Good. Now personally, I was feeling it a little more when I had my leg up here, so I'm going to try that again. Here we go, number 4. Nice. Now I'll tell you why that is, because as you can see, I can slightly adduct my left leg while I'm going through this movement. As my legs here, I'm slightly leaning this way, and it's keeping my pelvis pretty level. But when I'm down here, as I'm coming over, it's harder to do that. Instead of being like that. So that's my theory on that. I'm going to go for a few more. Bringing that leg up. Adducting this leg. And here. Deep breath in. And rotation. Good. Nice rotation. That really opened up. 1 and 2. Good. We'll get a couple more there. Feel free to take as long as you need in between repetitions. There's no rush here. That's what AIS is all about. Taking your time, getting accumulating results. Deep breath in. And rotation. 1, 2. Still going. 1 and 2. Very good. So how do you know how far you get? How far do I bring my knee over before I start rotating? Just judge it by how much resistance you get. If you're hit up against that wall, that's as far as you can go. Start with the rotation. Okay. And we'll get one more here. Good. Last one. Deep breath. And push it all the way over. Good. Rotation. And 1 and 2. Excellent. Perfect. Very nice job. Okay, great job so far. This is going to be our final stretch for today on this video. It's going to be internal hip rotation. And what does that mean? So we're going to be using our hip, we're going to be rotating it inward using our internal hip rotators, namely our TFL, and we're going to be pulling it out So our foot's going to come out to the side, and we're going to be stretching our external hip rotators. Okay? So in the last one, we did stretch out, our piriformis, our glutes, but we also did stretch out our internal hip rotators a bit by giving external hip rotation. So don't let all this confuse you. Just think, if you're doing internal rotation, you're stretching out your external rotators. If you're doing external rotation, you're stretching out your internal hip rotators. Okay? This one, you need a rope. So go ahead and get it. I know I was being a little soft in the introduction, saying maybe you didn't need it, but you absolutely do need this. I highly recommend you go and get it. Its applications are very important in the AIS. Okay? So think about it. So we're doing internal rotation. Which way does the rope need to go? Right? Around the inside, which is going to help us with the internal rotation. So same position on your back. We're going to be doing this movement right here. Now there are 4 or 5 positions here in our AIS and in your hip that you can stretch out your hip rotators, okay? And you can bring it all the way down, pretty much down to here. The trick is, keep your leg on a right angle, keep your hand firm on the rope for support, and don't bring your leg up too much or down too much. You want your knee to be pretty centered up at your hip and leg on a right angle, okay? So we're just going to do a few of these. Let's go ahead and do, let's say, 1 or 2 in each position, just to give you an idea. And then you can go ahead and do as many in each position that feels good for you on your own. Okay? Also keep in mind that if you're getting jammed up on this one, it may be that you're actually, your internal hip rotators are actually tight. So namely your TFL, maybe you want to go back to the other one, or we're going to add in some other ones at another time. So here we go. So knee right over your hip, leg on a right angle, get your hand on the rope. Rope is around the inside, wrapped around the bottom of your foot, providing internal rotation and assisting to the movement, okay? So normal here would be about, you can get it to about 90, but we're going to just shoot for about 45 degrees, okay? So head back, relax, arm is supporting the knee here to prevent compensation. Exhale. And 1, 2, perfect. Okay, we're using our internal rotators to assist in stretching our external rotators. And 1, 2, good. So that's 2 in the top position. We're going to bring it over 10 degrees and do 2 more. And rotate with the leg. My arm could be doing nothing. I'd still be getting a stretch just using my leg there. And so 10 degrees right there. Maintaining, rotating. 1 and 2. Bring it down. Relax for a second. And back up into it. Find your 10 degrees. And 1 and 2. That's a good one. I tend to get, or I did tend to get jammed up in my TFL, right up in there a lot more early on, but since I stretch my TFL out, I get a lot less jammed up in there, a lot less pain every time I do these stretches. Okay? You may find the same thing going on with you. So, on to number 3. 1, 10 degrees, 20 degrees, and here we go. And exhale. 1, 2, very good, bring it all the way down. And again, top 1, 2, here we go, 20 degrees. Good. That was a good one. Definitely feel free to take more than 1 breath on each of these. You don't need just 1 breath, and if you're out of breath, hold your breath. Keep breathing into it, and then if you need, your body will, your mind is sending a message to your body to relax as you exhale. So keep on with that exhale throughout the movement. Okay? Even if that means taking more than 1 breath. So that's 1, 10, 20, 30. Here we go. Good rotation there. If you get pain, don't push through it. I stretch a lot, so I can get pretty far here. Whoa, yeah, that's a good one. And relax that completely. People tell me I tend to stretch a little harder than I need to, so it would be a smart idea to maybe not go as hard as I do. Oh, there we go. Be gentle. Here we go. Nice. And 1. Oops, we're going 1, 2. And very, very important with these ones. Do not come out of it fast. Come out of it very slowly, as slow as you went to it. Think about a rubber band. You're stretching a rubber band out. What happens if you let go? It snaps. It's similar to your muscles. I'm not saying your muscles are like rubber bands, but as you come out, you want to go back in real easy. And be gentle with your body. It's the only way to go. You don't want to mess it up. So, how many positions was that? 1, 10, 20, 30. Here we go. All the way 40 degrees. Pretty much as much as my groin is going to allow me to go. Deep breath in and rotate. Supporting with your left hand, pulling with the right, rotating. And 1, 2, real slow come out of it. It's especially important. The deeper you get on this internal hip rotation, the slower you want to come out of it because you're more and more sensitive. Good. The last one here, same position, 10, 20, was it 10, 20, 30, and 40. Good. Here we go. And good, 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 good. Deep as you can. Without hurting yourself. And 1, 2. Good. Relax. So, that was internal hip rotation on the right leg. But if you get up and walk around right now, your leg is going to feel a lot different. So, follow that through. We did 2 on each. You can feel free to do 10 on each. I would say start with 5 to 7 on in each of the 5 positions, and go back and forth between 2 legs. 5, 7 on one, 5 to 7 on the other. Switch back and forth. You can feel free to do all of them in a sitting. Okay, and that'll take you a while just on its own. So, on to the next leg. So, internal hip rotation, coming around on the inside of the leg. Bringing it back down, starting in our first position, which is 0. So 0 degrees. And what I mean by 0 is, here it is, 10 this way, 10, 20, 30, and 40. Right? So 40 and 0. So 5 positions. All right? Let's go ahead. 2 and 0. And exhale. And 1, 2. Very good. And again, real gentle. I was pulling a little bit too hard there in the beginning before I warmed it up. And that's better. 1 and 2. Same thing with the assisting muscle group. You don't want to, in this case, it's mostly like TFL work in the first position. You don't want to overwork it, overexert yourself with the rotation using the assisted muscle. Just very gently, as much as you need to. Okay. That was first position. Second position, 10 degrees over, just over our hair. Okay, here we go. 2 more in here. 1 and 2. Good, and again. 1 and 2. I bet on the video you can already see how the difference of my hips on my right leg was much tighter than my left. Internal rotation. You may find the same. Your body, you have dominant and submissive legs. You have dominant, submissive shoulders, arms. Your body's not perfectly, symmetrical. So you'll find you are tighter in certain areas, and especially in the hip, you may find hip tightness may cause your back pain. You may, the piriformis tightness may cause your sciatica. It's very interesting how the muscles interact. Tightness in the foot can lead to almost a domino effect all the way up your body. It's very interesting. Same thing with your knee and your hip and your shoulder. So let's keep going. We did 0, 10 here. One more 10. Very good, yeah. So you can see I'm almost 90 degrees. If here's 0, 90 this way into the rotation, that's where you want to get to. 10 and 20. Here we go. Stretch number 3, 20 degrees. And 1, 2. Good. And last one here. Good. 1 and 2. Good. So that was 0. That was 10 and 20. Now we're going to go to 30 degrees. 0, 10, 20, 30. It's getting a little more tight. Here we go. Exhale. Still supporting with the right hand here on the left leg. You may not be able to reach the knee. 1, 2. Very good. But giving the support as much as we can. Maybe on the thigh, maybe assisting with the rotation a little bit. And good. 30. Relax before we go for the last deepest one at 40 degrees. My favorite one. The one I need the most. You may too. So 10, 20, 30, 40. Think about if your angles 0, 45, and 90. So just a hair short of 45 degrees there with your leg, your thigh. So find 40 and exhale. 1 and 2 and release. So you see how my opposite leg here is now abducted instead of adducted because we're doing the internal rotation. This is actually going to help stabilize our pelvis versus the last one where we needed to adduct it. Okay, last one here. Deep breath in. 40 degrees. So we covered all the internal hip rotation positions. Very nice job. Great. We covered a fantastic amount in our lower body with AIS today. We're going to have additional videos up soon covering more in depth these muscles as well as the upper body. We will in the future have condition-specific stretching, such as a specific video for sciatica, a specific video for patellar fasciitis. But for now, this was just an introduction video to give you an idea of what AIS is, how to do it, and how to apply that to the bigger, larger muscle groups of the lower body and release some muscular tension, hopefully give you some relief to some of your persistent symptoms if you have plantar fasciitis, patellar fasciitis, sciatica, lower back pain, these kind of things. So I hope this video helped. Thank you guys so much for watching. Please feel free to leave some comments. Send me some messages on YouTube if you have any questions. If you are in the Miami Beach, Miami-Dade, South Florida area, please feel free to get in touch. I'd love to meet up and work on you personally and show you how to do assisted isolated stretching and not just personal, yourself active isolated stretching. If you're national or international, feel free to drop a line. I'd love to help you in whatever way I can. Or feel free to visit us here in Miami Beach anytime. All right? Thanks so much for watching. Hope it helped. Guys, enjoy, practice, master this, and if you have any questions, contact anytime. All right? Thanks for watching. Take care. Bye.